मेरा नाम है धनंजय भौमिक। मैं वेस्ट बंगाल हल्दिया शहर से आया हूँ। अप्रैल महीने में मेरे एक पेट में बहुत दर्द हुआ था, तो उसी लेके मैं कलकत्ता में एडमिट हुआ था हॉस्पिटल में। तो उधर उन लोगों ने कंजर्वेटिवली मेरा ट्रीटमेंट चलाया। फिर बाद में बोला गया कि कोलोनोस्कोपी करने के लिए। तो मैंने कोलोनोस्कोपी हैदराबाद में आके एक प्राइवेट हॉस्पिटल में जितना भी रिपोर्ट्स है, कोलोनोस्कोपी एंडोस्कोपी सब करवाया। करने के बाद थोड़ा प्रॉब्लम निकला मेरे को। वो लोग बोल रहा था कि जिधर स्ट्रक्चर है मेरा वो उधर में बायोप्सी रिपोर्ट में कैंसर एंडोकार्सिमा को डिटेक्ट हुआ था। तो इसीलिए मैं उस हॉस्पिटल में और कुछ फर्दर ट्रीटमेंट ना करा के मैं डायरेक्ट चला आया अपोलो जुबली हिल्स यूनिट में, क्योंकि मैंने सुना था डॉक्टर किशोर आलापट्टी सर का नाम मैंने बहुत सुना था। इवन बहुत नेट पे भी सर्च करने के बाद भी उनका रिव्यू भी अच्छा लगा मेरे को। सभी जिसने जो रिव्यू दिया है, तो सर ने भी मेरे को एश्योरेंस दिया कि एक छोटा सा ऑपरेशन होगा लेप्रोस्कोपी करके। मेरे पेट में 3 ठो ही होल हुआ है। तो 13 जुलाई मैंने एडमिट हुआ हॉस्पिटल में, और 7 डेज़ के बाद मैं रिलीज़ हो गया। तो अभी पूरा फिट है हम। और जो कैंसर का ट्रीटमेंट जो है वो चल रहा है, मगर मेजर जो है सर बोल रहा है कि जो इंटेस्टाइन जो काट के बाद दिया गया है वही है मेजर। 95% प्रॉब्लम उधर ही सॉल्व हो गया है। बाकी 5% जो है वो केमोथेरेपी करके 100% क्योर हो जाएगा। तो मैंने बाद में ऑन्कोलॉजिस्ट डॉक्टर वेंकट संपत सर से भी बेसिकली ये का रेफरेंस था, डॉक्टर किशोर सर का रेफरेंस था कि वेंकट सर से जाके बात करो। उनसे भी बात करा गया। मैंने अपना फर्स्ट केमो ले लिया हूँ। अभी कोई प्रॉब्लम भी नहीं हो रहा है, अच्छा चल रहा है। तो दिखा जाए बाद में क्या होता है। होपफुली हमारा ये अपोलो यूनिट बहुत ही अच्छा है। मैं रिकमेंड हमेशा करूँगा सबको कि अपोलो जुबली हिल्स वाले में आओ, आके अपना जो भी ट्रीटमेंट है वो मेरे रिलेटेड अगर है तो बहुत बढ़िया है। अच्छे से आप लोग ट्रीट हो सकते हैं। थैंक यू वेरी मच।
Hi everyone, this is Dr. Kishore Alapati. I'm a consultant colorectal surgeon at Apollo Hospital, Jubilee Hills. As you've heard the testimonial, recently we've had a young chap named Dhananjoy Bhowmik. He actually is from Calcutta. About 3 months back he had severe abdominal pain, and he was admitted in the local hospital in Calcutta. Was diagnosed that he had appendicitis, was treated with medications, and after that, after he had recovered from that, he continued to have some amount of abdominal pain that continued to bother him over the past 2 months. So he came over to Hyderabad to get evaluated. He was seen in a couple of different hospitals, had extensive evaluations done, including endoscopies, colonoscopies, blood investigations, CT scans and everything. The one thing that was found on CT scan was that on the colonoscopy was that he had a stricture of the sigmoid colon. So he was explained that he has a narrowing of the sigmoid colon, and then he would require a surgery wherein he would have to go in as an open operation, remove a section of his intestine or the large intestine, and that he would require a colostomy bag for a certain amount of time. And then after that, once after he recovers from that surgery, then they would consider reattaching his intestine bags together. At that point, since he's a young chap working in an office and has 2 young kids aged at 8 and 10 years, he was looking for options. He came to us, and when he approached me, he was literally in tears. So we reviewed all his investigations and endoscopies and colonoscopies, at which point I've decided to repeat a colonoscopy again, and he definitely had narrowing of the sigmoid colon, and that definitely looked like a cancerous lesion that was causing the narrowing of the large intestine. So at this point I've convinced him that we would go ahead and treat him as an inpatient, admitted him, and I would have convinced him that we would be able to do a laparoscopic surgery and not having to do a colostomy bag. So he, after having explained to him completely what the treatment protocol and the plan is, Dhananjoy got committed, and then he got admitted into the hospital. And so at this point We've done what we call a complete bowel preparation, so intestines were cleaned up, and then we went ahead and did a laparoscopic surgery, reattaching the intestines back together without having to do a colostomy on this person. So he just had the surgery done about 2 weeks back. The biopsy did come back as a colon cancer, and we also found few of those cancer cells in his lymph nodes. So after that, the workup was complete, and he was referred to our medical oncologist for what we call chemotherapy after the surgery, which we name it as adjuvant chemotherapy. So stories like this is how we make a difference from Apollo Institutes of Colorectal Surgery. A young person in his late 30s or early 40s having to go through a open surgery, having to go through a bag which is a colostomy bag, and lead a life. And that had instantly changed when he had approached us. We were able to evaluate him properly, come up with a diagnosis, perform the surgery as a minimally invasive surgery, as a laparoscopic surgery, not have to give him a colostomy bag, reattaching his intestines back together. Now, even if he has to take chemotherapy, he can go back to work, and still every 3 weeks or 2 weeks he can go for his chemo treatments and get his life back to normal. So this is the impact that one would notice when you approach Apollo Institutes of Colorectal Surgery. We have an excellent team of surgeons, myself and Dr. Mathai, who take care of any aspect of colorectal diseases, whether it is cancerous or non-cancerous, with a comprehensive evaluation. Thank you very much for listening to us.